Lifestyle medicine, it is a specialty. You can get board certified in it. There's 7 pillars. Let's see if on demand I can remember all 7 pillars on recording here, but let's go. All right. So there is nutrition. There is sleep. There is movement, like healthy movement, move your body. There is stress management. Don't ask me why there's both stress management and mental health, but they're listed as separate things. I guess maybe one for you don't have a mental health problem, but you do have stress, and the other for you have a mental health problem. Let's optimize it, including speaking to psychologists and counselors. So that's 5. Avoidance of toxins is 6, and healthy connections is 7. So that's the 7 pillars. But I argue there ought to be at least 2 more: gut health and sexuality. And then maybe even 1 more, which is family interactions. Being a family medicine doctor, all those are important. But anyway, the first 7 were the official ones. You learn modules, you pass the test, you call yourself certified in lifestyle medicine. That is all from very strongly Western evidence-based. That's the limitation. The good thing and the bad thing about that is that if you practice as a lifestyle medicine physician, what you learned was double-blind, placebo-controlled trials, but they actually spent the time to find them amongst all the nutrition literature out there, as opposed to regular medical school. They don't spend much time, and you just never have a chance to, on your own, go sorting through everything, so you just kind of give up, and you just say, oh, that's not important. But with lifestyle medicine, they collect it together, and they spoon feed you the Western version of double-blind, placebo-controlled studies, which in my mind is limiting because, again, there's a lot of biases out there. There's no funding, hardly any funding for nutrition research, exercise research, and so forth. You're not going to find a lot of double-blind, placebo-controlled studies, but you're going to find a lot of little studies for the people that were interested in it. There's a branch kind of coming off of that, isn't official yet, I don't think, called longevity medicine, and there's lots of courses for it. That's more like biohacking your health, trying to live better, longer, through hormones, through devices. A lot of times, like, let's sleep more ideally, let's wear this little thing, and let's have a sound bed that gives you vibrations, and just all kinds of interesting things out there. Expensive, typically. I'm eventually going to get into that. It sounds very fascinating. Things like, I don't know if anyone's heard of this, but you have telomeres on your genes, on your chromosomes. When they are longer, you're healthier, you live longer. When they're shorter, it's usually that way if you have poor nutrition, lots of stress, and no exercise. The idea is make those telomeres long. It also helps you express your genes better. It's not just genetic, epigenetic. A lot of that has to do with the lifestyle.